Welcome, everyone, to the Center for Advanced Research and Innovation. Here at Charisma University, we are proud to present original research in various fields. The committee members are Dr. Waller, who is on here today, Dr. Jimison, Dr. Chukawaka, and Dr. Butera, who also is on the call. I am Dr. Dean, and I would like to just do a couple of housekeeping things. A friendly reminder, please mute your microphone and turn off your video. I would like to introduce the Dean, Dr. Waller, to introduce our presenter today.
Well, good morning, or at least it's good morning in New Zealand, good afternoon in your part of the world. But it's my absolute pleasure to introduce Dr. Ayim, who's been with the school now for quite some years. He's a highly regarded professor by both the students and by the lecturers in our School of Health Sciences, and you'll see in a moment why. He has an enormous practical experience and theoretical experience in the field, in the health intervention and prevention field. And for that, he's incredibly knowledgeable and willing to share it with all of us. So that's a nice public. He's also published a few articles and in particular a book I think he's going to talk about this afternoon or this morning in my language. And it's now, as I believe, in the second edition. So it's a popular book, and it's certainly, from what I've seen of it, is a really interesting field on the subject, or an interesting presentation. Now, I hope that everybody here will find this talk interesting and particularly relevant to each one of you. So without further talk from me, Professor Ayim, it's all over to you.
Thank you very much. Yes, I'm very, very honored to be presented by the Dean of School of Health Sciences, my Dean, and my first time to participate in the CARI presentation, February 4th, 2023, and I'm so excited about it. So that is my affiliation, Ping One, and okay, I am Professor Martin Ayim. A bit about me. I'm endowed professor of public health education at Grambling State University in Louisiana. And I did a PhD in public health education at Texas A&M University, College Station, Texas, in MPH, Community Health Promotion, Indiana University, Bloomington, Indiana. The BS in Health Administration at Indiana University, Bloomington, Indiana. I'm a certified health education specialist, and I'm also the curriculum builder for the health promotion program here at Grambling State University, which has now been made, it's been made 100% online starting fall 2023. I love it. I've been an adjunct professor at, I am an adjunct professor here at the public health program at Charisma University, affiliated with the School of Health Sciences. I must say I'm loving it so much, and hopefully we will be having more students enroll in courses. But everything starts from somewhere. I've served as an adjunct professor at St. Monica University, Cameroon. I built the MPH Health Education and Health Promotion program. And I'm also the executive director of an NGO, which is Minority Health Promotion Initiative. I'd like to serve the underserved, underprivileged in society. So this NGO is geared towards that. I'd like to give back to community. And I love to teach. Bottom line. This is the advert that I know when the book was launched, Communicable Diseases for School and Community Health Promotion, Global Health Perspective, the second edition. This when it was launched, the flyer that I made. And this is the book. This is the cover page, and you can see it here with me. There's a copy of the book with me here. And okay, it is highly recommended for courses in epidemiology and global health. Let me be organized with a tailored outline of this presentation today. Title of the presentation, motivation to write the book. How the book is organized to cover the discussion of the 132 communicable diseases discussed in the book, and a table of contents, how you can consummate the book and make good use of it if you are adapting it to teach, and then questions and comments from my dignified audience. Motivation to write this book. I have worked with the Minister of Public Health in Cameroon for over 10 years. And as a registered nurse, because I did this registered nurse program, School of Nursing, and I graduated and I had personal experience during a community health education outreach as a student nurse during a health talk about prevention of intestinal worms. And believe it or not, we had this disgrace in the community because we thought we came from, government institution. We have fear where, we can just go do anything. And we went to Bambui. We didn't go to see the traditional leader or the head of the community. We just went straight to the health center to do our thing. And lo and behold, these guys, the attendees, the community, the word went to the phone that some foreigners were here talking, and then the traditional leader sent for us, and that we had no right to go talking to his people without passing through him. So the people basically dispersed. We had to go to the community leaders' palace, apologized, and then he ordered the people to come, and lo and behold, before we got there, the place was filled. That is how, in health education, you must respect culture, beliefs, and practices of the people. Work with the people. So this time, the community participants rejected the message we had about intestinal worms, even after all this to get them listening. They rejected the message, outrightly say intestinal worms are normal in the human intestines. They couldn't understand, they couldn't believe or say worms are abnormal. They said, now we have come to tell a lie. That's why we didn't go to see their chief. They accused of the students, nurses of lying. Now, I was challenged in this area. This is where my motivation to come study in this field, to go back and invest and educate the community came from. And I wanted to come over and study and be impactful on return to the country. So I further saw the need for understanding cultural values, beliefs, and practices in health education and health promotion. So, lo and behold, we found out that the rejection of the message of intestinal parasites, their perception about intestinal parasites was the small intestines. To them, intestinal parasites were the small intestines, and they could not see how people could not have small intestines, but we did not see it that way. So there was a disconnect. There was a disconnect, and values clarification would reconnect and make things better. But that is their perception. So that sends a serious message to health educators that what you think and what you know is not necessarily what and how the people you are talking to think or know. So the effectiveness of teaching comes into play here. So with that challenge to go study overseas or to further my education, I applied to Indiana University. In fact, I also applied to the University of Georgia, Athens. Indiana was very quick. So I was given admission at Indiana University. But how did I come to know about Indiana University? American Peace Corps working in our country. We had discussions. And when they heard me talk and the way I was articulating my points, she said, but you look like you should be somewhere else. You should be somewhere else. You sound very intelligent. You sound very motivated. I'm like, yes, I have been thinking, and I don't know how to go about it. She gave me the address to Indiana University. And that is how I ended up being at Indiana University. It came very quick, and I was admitted there. Then, from Indiana University, and now the academic advisor at Indiana University had connections with the Texas A&M University School of Health Education. So with that connection, he said, well, sir, I have a good PhD candidate for you. And then through that, I got admission into Texas A&M. All right. And my dissertation at Texas A&M was a comparison of health education perceptions between the Chamba and Widikum ethnic groups in the Northwest province of Cameroon. I was determined to go back, and I'm still determined to go back and make an impact in the quality of life of the people and advance health education and health promotion. Lo and behold, when I finished the doctoral program, wanted to go back home. The only university that was home at then, University of Boya, guess what they told me? That they had no money to pay me. So there was they had no money to pay me, so there was no job for me. No, I'm like, what? Even when I volunteered to come back, and so there was, I couldn't get a job because that's how Cameroon is. They don't encourage people coming back to invest. That's how I ended up working at Grambling State University. But I still have down the road to invest, to make a change or a difference in the community. So while I was taking these classes, communicable diseases classes at Indiana University and Texas A&M University, I saw a need to fill the gap in the teaching of communicable diseases at college level. Right. I saw a need to fill that gap. So while teaching at Grambling State University, I followed my innovative approach of teaching about communicable diseases. The students loved my classes and notes. Then the students suggested that I write a book. It didn't occur to me. They suggested. They went further to choose the title from many that I suggested. So this is a great example of student-teacher collaboration. Okay, so all the students who participated in the writing of this book have been acknowledged. The first edition and second edition. This book is written in textbook format with 9 sections, 24 chapters. Global perspective of each disease is discussed, questions for review and tests, and subject index. So there are 132 communicable diseases discussed in this book, including COVID-19 and the Delta variants and Delta Plus. You have it. So it's a rich book from my perspective. And I also created a nonprofit organization called Minority Health Promotion Initiative, which I told you I'm an executive director, to address the need for drinking water to prevent intestinal worms in rural communities in sub-Saharan Africa. That is why proceeds from this book will also be used for community humanitarian services, a legacy of my mother. I always pay tribute to my mother. My education came about because my mother was at the center of this. Believe it or not, my mother never went to school. She never knew how to read and write. I'm talking about the early 50s. This is the woman who forced me to go to school. She would really whip me to go to school. and she would she makes friends with the teachers. She sits there and listens to the teachers. She asks the teachers, if a child is doing well, how do I know? The teachers told her how they'll check it. A check mark, that is correct. An X is cancer. Okay, one evening, my mom surprised me. She said she wanted to see me study. You want to see, I should bring her my books to her. I should bring my books out. I started laughing. I said, you don't know how to read and write. How are you going to cross-check whether I'm passing or not? All right. I said, okay, take it. She took the book, my book. She opened it upside down. All right. But was able to see that X and the check. So when she saw, unfortunately for me that day, the activity we did, I had many things wrong. She saw X, X, X. There was a span on my head that I'm eating food, I'm not doing well in school, that I failed this, I failed that, I failed this. I'm like, what? How did you know this? All right. And then she normally went to the market, bought a bush lamp, because by then there's no electricity. She bought a bush lamp. She made sure that every evening I studied. Whether I'm studying the right thing, but she was on my head. And in fact, because of that, I pay tribute to my mother when it comes to education, educational and professional achievements. And that is why she has been honored in this book, and the proceeds will go to advance a cause that she is very much interested in. She used to help people a lot, so I continue the legacy. And this time related to why I was motivated to go study abroad, intestinal parasites, and how can I help through clean drinking water supply to the community. So I think with that, I'm giving back to the community and being self-actualized. So, organization of this book. I said earlier, there are 132 communicable diseases covered in the book. The book is organized in 9 chapters with related chapters to simplify the study of communicable diseases and the understanding of infectious disease epidemiology terms and concepts. So sections cover basic principles of education, of epidemiology, vital statistics on rates and ratios used in epidemiology, principles and practice of immunization, viruses and viral infections, bacteria and bacterial infections, infectious diseases caused by fungi, protozoa and metazoa, and the major sexually transmissible infections, and epidemics and pandemics in the history of global health. Sections cover 24 related chapters. So each chapter covers a cluster of communicable diseases classified according to infectious agent and the mode of transmission. So with me, that facilitates the study of communicable diseases at college level, master's, PhD. Okay. The second edition covers global perspectives of each disease and a new section 9 covering epidemics and pandemics in the history of global health. There are questions for review and discussion and a sectional bibliography for further exploration. So furthermore, there are links provided for further reading about each disease from other sources. Questions for review and discussion are recommended for essay examination, questions and reading guide for students. So finally, each disease discussed has its assigned latest edition of the International Classification of Diseases, ICD-CM, clinical modification number. And that is what doctors use to diagnose, assign diagnosis, certified diagnosis of a disease. ICD-CM right now is number 10, 10th edition. So a subject index carries page numbers of each of the communicable diseases for quick reading and review. So students can easily flip to the back. If you want to know about measles, you go to under M, you see measles, you see the page, you can go back to the book, and then you read about measles. Like that. That's what it means. So, the table of contents. Under table of contents, you have acknowledgement page, dedication, forward, professional recommendations from other professors. Dr. Torabia, I honor him a lot, Indiana University, and Magnus University, Dr. Hansen there, and the preface and then the table of contents themselves. I will just show you the table of contents. I'm not going to discuss each of them. It's a lot. It's more than 1 hour presentation there. We're trying to narrow to 20 minutes. I just show you how the book is laid out. And anybody, you can go into the book and then you will, get specifics. But I'm just giving you an appreciation of how the table of contents is organized. You have in section 1, principles of epidemiology. You have these three chapters there, the definition and clarification of terms, infectious disease theories, processes, and types of epidemiological studies, and then the classification and prevention of infectious diseases. And then you have the sectional bibliography. That's section 1. We will have section 2 covers vital statistics, epidemiological rates and ratios. Okay, that's section 2. Section 3 actually is a morbidity and mortality rates. Okay, and then section 4 actually is calculation of morbidity rates and ratios. I did there's a little typo there on the screen. So 4 is supposed to be 3, and where is blank is supposed to be 4. And chapter 5, vital statistics, mortality rates, and ratios. So, and then you have a sectional bibliography right there. And that's it for section 2. Section 3 covers principles and practice of immunization. And you have 2 chapters there, chapter 6 and 7, principles of immunization and the practice of immunization. Then you have a sectional bibliography. Okay. Section 4 covers viruses and viral infectious diseases. Chapter 8 will cover overview of viruses in general. Then chapter 9, the viral infectious diseases transmitted through contact. I broke it down to those transmitted through contact. And then chapter 10, all these are still under chapter 9, have a list of them. Chapter 10, the viral infectious diseases transmitted through respiratory or gastrointestinal route. So they are discussed under the agents of transmission and the mode of transmission. That's a better way to describe the disease. It's clearer to students. So, okay, we're discussing, what are we discussing? Okay, it's viral infectious diseases, but those transmitted through the respiratory or gastrointestinal route. There you have them listed there and discussed. That's chapter 10. And then chapter 11, viral infectious diseases transmitted through interaction between animals and humans, insects and mosquitoes. Animals and humans, zoonosis. Okay. Then you have a list of them discussed, specific, okay, down to yellow fever. There's section 5. I'm through now. We're through with viruses. We'll go to bacteria. Section 5, bacterial and bacterial infectious diseases. 12 will give you an overview of bacteria in general. Then chapter 13, those bacterial diseases transmitted through contact or respiratory tract. You have them listed and discussed. And each disease you see there is discussed under the infectious agent, in fact, the definition, diagnosis, infectious agent, mode of transmission, mode of control, mode of prevention. All right. So each one of them is discussed under those headings. That's why the book is Chapter 14, some foodborne bacterial infections. You have the various foodborne bacterial infections discussed, chapter 14. And chapter 15, bacterial diseases transmitted through interaction between animals and humans or through vectors, that's mosquito or insect bites and fleas. You have a whole series of them discussed, from anthrax, meningitis, down to pinta. So, and chapters, now that was section 5. Now section 6. We were through with viruses, bacteria. Now we look at the fungi, protozoa, and metazoa. Section 6 covers that. Infectious diseases caused by fungi, protozoa, and metazoa. So chapter 16, overview of fungi, overview of protozoa and metazoa. Discuss them. Also, they discuss the classification of living things and organisms, fungi, protozoa, and metazoa. It's really loaded. In chapter 17, fungal, protozoa, and metazoal diseases transmitted through skin contact and respiratory tract. You have those specific diseases, ranging from blastomycosis to hookworm diseases, schistosomiasis, down to typhus fever. They're all discussed in this chapter. And chapter 18, overview of intestinal parasites and helminths. Yes, you can relate to this, right? This is exactly my motivation to go study. This was the topic of our health talk in the community. So, overview of intestinal parasites and helminths, the intestinal worms. Okay, and then chapter 19, some fungal, protozoa, and metazoal diseases transmitted through the intestinal tract. You have them, roundworms to, the guinea worms and all that, all those specifics. I'm not going to specifics here. So but that gives you an idea of how the book is organized. That's chapter 7, section 7. Okay, and that is still chapter 20 of section 7, fungal, protozoal, and metazoal diseases transmitted through interaction between animals and humans, through vectors, mosquitoes, and insects. There you go. You have all the Lyme disease, the malaria, and sleeping sickness, etc., are all discussed under this in chapter 20. Okay. Section 8. Section 8 covers STIs, sexually transmissible infections. And chapter 21 discusses the various sexually transmissible infections. And take note all of this with global perspectives. Okay. Then section 9, epidemics and pandemics in the history of global health. You have major epidemics from Black Death to what do we have as COVID-19 outbreak today. Okay, series of epidemics and pandemics in the history of global health. Chapter 22 is an overview of the pandemics in the history of global health. See them there. From prehistoric time, from 3000 before Christ to current. Okay, they're all discussed there, chapter 22. Now, to be contemporary, chapter 23 covers contemporary global pandemic, COVID-19. Okay, COVID-19 discussed in detail. And chapter 24, emerging epidemic and pandemics. COVID-19 now has its variants. and the Delta variant and Delta plus variant. So chapter 24 covers that. There may still be some variants. So in the review, in the third edition, they will pick up from there to update the book. But for now, it's covered content up to 2022. You have appendices. There are two appendices: the ABCs of hepatitis and guidelines for confirmation of foodborne disease outbreaks are the two appendices of the book. And then you have the subject index and about the author, a little bit about me. That accounts for the 534 pages of the book. Yeah. So I've run through everything, and I hope I've not gone over 20 minutes, Dr. Wade. Forgive me if I have. I cannot help it. So that is a presentation of my book and what was intended for CARI 2023, Communicable Diseases for School and Community Health Promotion, Global Health Perspective. So with this, I can entertain questions.
Dr. Ayim, this is Dr. Dean.
Yes.
I see that you have shown us your motivation about this topic, and it's been awesome to hear your words. My question is to you, what is your next, where are you going to go from here?
Where am I going to go from here?
Correct.
I continue to teach, continue to effect community health education, continue to do the the non-NGO that I have, and try to see what I can do to get programs, funding to impact health in rural Africa, get funding to supply drinking water in rural communities. The challenge going forward is application of all this to make a difference in sub-Saharan Africa, in particular, and more focus on rural health. Yes. And of course, talk about the book, and so people like you can buy the book and spread the word about the book. That is a picture of my mother there. Thank you for that question. And I call her the champion of charity. Ngwenjin is the village where I was born, in Widikum. And yes, this is how to order the book. It's both hard copy, paperback, and ebook. And Amazon.com/author/Ayim 2021. It's KDP, published by Kindle Direct Publishing. And that link is very crucial. The Library of Congress number is there, listed. So thank you for that question. That's where I go from here.
Thank you very much. This has been a wonderful presentation by you. So thank you very much.
Yes, Dr. Ayim, I have a question. How much cooperation do you feel that Sub-Saharan Africa and some of the surrounding countries are giving some of the other difficulties that we know exist there for gender-based violence? And, there's just a lot of things that go on there. Do you think that the governments are motivated to see a healthier nation?
Yes, that is one of the challenges I have as a forerunner in health education and health promotion in my country, in Africa. We will have to, first of all, sell the idea that health education and health promotion is needed, to the various governments and to the people. we're working hard on that. And by going to Boya, for example, and putting together a health education and health promotion curriculum, it's a way of reaching out to educate and to arouse curiosity to promote health education and health promotion. And it's work in progress. Honestly, it's work in progress. We're in the building phase of doing that, and collaborators will be highly, highly appreciated. When I traveled to Africa last December, I went to Malawi actually, and while there, I tried to identify orphanages around there, and I talked with some government officials and some managers of orphanages if how we can collaborate. If I may write a grant or something that we can be implemented in that country, and those will be collaborators and partners there. So that was one of the things I did in December. And in fact, Doug, if you have an idea, I'm very open. We're very much entertained how we can progress from this, because funding is the key. Funding is the key. If we're writing for grant proposal for funding, you will have to demonstrate all these partnerships and collaborators, etc. Money is the key. Get things done. Yeah, thank you.
And it's John here. I just have one question, really. First of all, congratulations on the book. I do actually have a copy, so so I can talk a little bit better. Having written the book and an enormous amount of effort that went into it, is there anything you would change as a result of having written that book? Is there anything you would do differently, you think?
No.
Right.
No, there's nothing I would do differently, and it's intensify on what I have done, and to help build more academic programs here and there, and get the message out here and there. And that's
Right.
why I'm excited about teaching online and all this. I'm trying to reach out to sell.
That's very good. The other interesting thing from my perspective is you went to Africa recently. You just mentioned it. What do you see some of the challenges? I know there are lots, but what are the ones that you particularly are involved with? Drinking water would be one, I guess, in some of the remote areas. But what are some of the other challenges you see?
Yes. Just let you know that while there in Malawi, I was down with malaria.
Oh, really?
Yeah, whole professor of health education, health promotion, malaria parasite visited me.
I know.
Yes, I was down for 1 week with malaria. So yes, the presence of mosquitoes and insects, and the need to educate the people about environmental sanitation and stuff, yes, it's one of those challenges. Mm-hmm.
No, thanks very much for that, and once again, congratulations on your book. It's a fantastic effort.
Thank you, Dean.
All right. Are there other questions? Well, Dr. Ayim, while we were talking, I went ahead and ordered your book, so it was very interesting. So I wanted to kind of get a handle on communicable diseases. So, okay, well, thank you on behalf of the CARI team and myself. Thank you for doing your presentation, sharing with us that information, as well as those of you who have attended. This will be posted on our YouTube channel in the next few weeks, and our next will be on March the 4th. So we have another presentation in 1 month from today. It's looking like it may be around 11 a.m. So we'll get that information out to everyone, and we thank you for your attendance. Dr. Ayim, would you do me a favor, and in the chat, would you post your phone number, please? All right, if you can.
Phone number?
Yes, in the chat. Dr. Butera, will you cut your
Let me stop share.
There we go.
Then go to